Hi, everyone. So we're into week 3 in community wellness, and I've been following all of you on the your first discussions, and also have reviewed your choices for your environmental article review. So before we get started with the content for this week, let's talk a little bit about the article review because that does need to be uploaded this by the end of this week, as well as putting a copy in the discussion question Dropbox, and also reviewing two of your fellow students' reviews and commenting. So you all have some interesting topics. Just remember, this is you should be picking a topic that addresses an environmental concern in the community. So um, some of the ideas that people have worked with is air quality, water quality, and quality too can be both indoor, um, in a living circumstance, and then certainly out in the neighborhoods, depending on what kind of um, environmental concerns are in the area, smokestacks, um, some kind of pollution that's being spilled into the neighboring area. Those are certainly good examples of environmental issues. People have looked at lead, additives in foods. One of the students in the face-to-face group I had talked about the addition of soy in into our food chain, and how it's being used as a replacement, obviously, for different kinds of dairy, and then also for meats, and the concern that soy is somewhat of an estrogen compound or a substance, and again, following through with that concern about higher estrogen levels in the body. So um, there just are a lot of different topics that you can explore, and I really encourage you to do that. So keep in mind, you should, again, I sent an email out because someone was having a problem with the original Dropbox for the environmental article review. So there's also an alternate that the tech department opened. But please, I would prefer that you put your assignment into the original Dropbox for the article review, and then also include your permalinks for your two supporting articles. And make sure that the permalink actually links to the article and not just to the top cat entry for the library. Some students made that mistake, and then have to go ahead and go back and upload the correct link. So I want to just prevent that from happening. So I will be looking forward to. I know some of you have already uh, submitted the assignments, so I'm going to start looking at those this week, and I'll get back to you with comments in a rubric. So this week, oh, and one other thing too. Just please make sure that you understand that the Turnitin Dropbox is not working, and that's just kind of system wide. I'm not quite sure when that will be up and running, so we're not going to worry about it at this point. So this week, we're going to be looking at program planning, and this is going to follow directly from your windshield survey or community assessment. And I just want to emphasize how really nicely this ties together, because you're going out and you're looking at a surrounding community, and then you're going to identify one major problem that you want to work through, and create a community nursing diagnosis and care plan for. Um, this is the basis for the work in the community, and it is just so important because whenever program planning is established, it really follows from the information that's gathered during a community assessment or as you're doing a windshield survey. And I'm going to put a very short PowerPoint up on in week 3 that just lists the different kinds of achievements that we've made in public health during the 20th century. But I want to hold this up because the PowerPoint also includes these photos, and this is just darling, actually. That this is something, it's a publication that was put out by the CDC, and it talks about the 10 great public health achievements in the 20th century from 1900 and 1999. And if you look, the infant on the one side is also the older woman at age 99 on the other side. And just to give you an idea of some of the achievements that have been taken care of or addressed during that time period. We looked at immunizations, motor vehicle safety, workplace safety, control of infectious diseases, declines in death from heart disease and stroke, safer and healthier foods, healthier mothers and babies, family planning, fluoridation of drinking water, tobacco as a health hazard, and then it further goes on and addresses future directions. But again, this just is a wonderful representation of what strong community assessment can do, and then program planning. So you're going to have a little bit of experience as you follow through and construct this community nursing care plan. One other reference, or actually there are two that I want you to pay attention to, and this is just to give you some ideas and help you with this assignment. There, there is a copy of Carpenito's, it's from her nursing diagnosis and care planning text, and it is actually a whole chapter on community diagnosis. So please look at that. That's a really helpful tool to use. And then also, which comes directly from public health, it's a PowerPoint on the Minnesota intervention wheel. And this describes in detail the very specific kinds of interventions that public health, community health nurses are prescribed to do and what they include. So if you take a look at it, it's very informative. It'll give you a lot of great ideas about how you can interact in the community, and this is everything but direct patient care. So it looks at things like health teaching, collaboration, coordination, community outreach, case finding, case management. I just take a peek at it. And I'll give you an example of how really directive it can be and give you some great ideas. Let's take cardiovascular disease as a health concern. And if I looked at the wedge, and that's how the Minnesota intervention wheel is broken apart, I'm going to look at health teaching. That's probably one that is very easy to think about in the community, because that's what a lot of you are going to move forward and try to tackle. So the intervention wheel looks at three different levels of interaction. It looks at the individual themselves that we work with. It looks at the community participants, or the community, and how we can help them. And then it's interestingly looks at what we call systems interventions. And these are, again, so important, because I always think of it as I'm going to look at a program that's functioning and I'm going to make it a little bit better. I'm not going to reinvent the wheel. I'm going to make it a little bit better so I can improve, hopefully, the outcomes for the clients or patients I work with. So let's look at, just quickly, cardiovascular disease, and then I'll talk with you about the program planning and some specifics. If I looked at the individual level, I could work with individuals that are identified at a community screening with high blood pressure, and I could focus on nutrition and exercise, and then maybe talk with them about use of medication. At the community level, I could work with, in coalition with places like the YMCA, to sponsor exercise and nutrition programs, and maybe make sure that the timing is more beneficial for some of the participants I'm working with. I think that's one thing that gets in people's way. They're not at the right time during the day. They just, don't work out if they have a busy work and family schedule. And then at the systems level, I could work with, for instance, a local school district that would give money or dollars towards insurance copays if employees took part in health screenings or other health teaching programs. And I think some of you probably have already seen this kind of thing implemented. This is a great example of a systems intervention. We're taking something that's already there and we're strengthening it to make it better for the patients that we work with. So let's go back now and look at, again, kind of the steps as you go through identifying this problem and how you're going to construct this community nursing care plan. From your assessment data, and let it come from the data, pick a problem that you see. It could be lack of health care services. It could be increased rates of teen pregnancy. It could be increased rates of sexually transmitted infection. It could be some kind of environmental concern. And when I think about this, there is a whole range of areas that that you can identify. besides the ones that I mentioned, maybe something with communicable disease. Um, that's maybe a health promotion need for a specific population, like migrant groups that are interacting in the community or live there for a certain portion of the time. So you identify your problem. Then you think about and really use that evidence based practice guidelines. You want to really go back into those. How can I pick guidelines or interventions that we know will help? And you should pick three short term interventions and three long term. And along with them, a short term goal and a long term goal. And I want to give you some ideas about that because I think that confuses people. I have found it very easy, first of all, when I look at short term goals in the community, to do what's called process goals or process outcomes. So let's pick sexually transmitted infection. So I'm going to, for instance, I'm going to, my target or my goal is going to be that I'm going to instruct 75% of a certain high school students, or they will participate during such semester in an educational session on decreasing risky sexual behavior. So that's kind of along the way, that's what I want to accomplish. Then my long-term goal will be an outcome goal. So in 3 years' time, when I go back and review statistics, um, I'm going to see a 10% drop in uh, STI diagnosis among the female high school students at this particular school. So again, it's the process is what's going on along the way. The outcome or a long-term goal is what do I do? What kind of effect am I going to see? So I'm going to see a drop in of 10% in the amount of STIs that are diagnosed. Then my evaluation, because we're not going to be there to find out, think about what you have to go back and look at. What statistics do you have to access to make sure that you have accomplished your goals? So I'm going to leave it at that. If you have questions, please let me know. I don't want to run out of time. And just again, enjoy this process. This is just so important. You are really learning to do a significant piece of work in the community and really how important it can be and what wonderful results it can bring forth. So I will see you next week, and I'll be in touch via email, or I know I've already talked to some of you on the phone, so and that's been wonderful. It's nice to hear your voice and connect that name. So let me know if you have any questions.